Okay, this is Chapter 17 of the Nutrition ATI book, Cancer and Immunosuppression Disorders. Nurses should be knowledgeable of nutritional needs for clients who have cancer and immunosuppression disorders. Cancer and cancer treatments can affect chewing, swallowing, satiety, digestion, taste, appetite, nutrient absorption, use of glucose, and stool formation, dependent on type. Protein, calorie, malnutrition, and body wasting are common secondary diagnoses for clients who have cancer or immunosuppression disorders like HIV and AIDS. Nutritional deficits are a major cause of morbidity and mortality for those clients. Adverse effects of treatment compromise the nutritional status of affected clients. Immunosuppression disorders increase the body's metabolic demands. Alterations in fat storage and metabolism are related to medications used in treatment of the disorder. While subcutaneous fat is lost in the face and extremities, fatty deposits occur in the liver and skeletal muscles, which is called lipodystrophy. The goals of nutritional therapy are to minimize the nutritional complications of disease, improve nutritional status, prevent muscle wasting, maintain weight, promote healing, reduce adverse effects, decrease morbidity and mortality, and enhance quality of life and overall effectiveness of treatment therapies. Nutritional plans are individualized for client needs. Assessment and data collection. Current illness and presence of other medical diagnosis and nutritional habits, food preferences and restrictions, food allergies, height, weight, body mass index or BMI, weight trends, risk factors, immunosuppression disorders, unprotected sex, which is HIV, use of contaminated needles, injection substance use like HIV, use of medications that have immunosuppressive effects like cytotoxic medications, corticosteroids, disease-modifying immunosuppressive medications, history of radiation treatment, and congenital immune deficiencies. Cancer is obesity, excessive fat intake, sedentary lifestyle, consumption of processed meats, red meats, refined grains, excessive alcohol intake, family history, and history of cigarette smoking. Laboratory test: prealbumin, albumin, ferritin, and transferrin. Nutritional guidelines and nursing interventions. Immunosuppression. Monitor the effectiveness of nutrition, weight, BMI, and laboratory findings. Assist the client to set realistic goals for nutrition and food consumption. Instruct the client on strategies to manage adverse effects of treatment. Client education. Make food choices based on nutrition recommendations. Cancer. Excess body fat stimulates the production of estrogen and progesterone, which can intensify the growth of various cell types and can contribute to breast, gallbladder, colon, prostate, uterine, and kidney cancers. Nursing actions. Use semi-solid thickened foods for clients who have dysphagia and instruct them to sit upright and tilt their head forward when swallowing. Client education. Eat more on days when feeling better on good days. Consume nutritional supplements that are high in protein and or calories as between meal snacks. When necessary, use as a meal replacement. Increase protein and caloric content of foods. Substitute whole milk for water and recipes. Add milk, cheese, yogurt, or ice cream to dishes. Use peanut butter as a spread for fruits. Use yogurt as a topping for fruit. Dip meats in eggs, milk, and breadcrumbs before cooking. Preventative nutrition. Consume adequate dietary fiber, 25 to 38 grams per day, depending on sex and age, to lessen the risk of colon cancer. Eat at least 2.5 cups of variety of fruit and vegetables daily, linked to lowered incidence of many types of cancer and obesity, which affects the risk of cancer development. Foods high in vitamin A, like dark green, red, and orange vegetables. Foods high in vitamin C, like citrus fruits. Cruciferous vegetables like broccoli, cauliflower, and cabbage. Consume whole grains rather than processed or refined grains and sugars. Low-fiber foods and foods high in fat can cause a variety of cancers: lung, esophageal, pancreatic, oral cavity, cervical, kidney, bladder, liver, and stomach. Avoid meat prepared by smoking, pickling, charcoal, and grilling, and use of nitrate containing chemicals, possibly carcinogenic. Consume polyunsaturated and monounsaturated fats found in fish and olive oil, which might be beneficial in lowering the risk of many types of cancer. Limit alcohol consumption associated with many types of cancers. Therapeutic nutrition. Cancer can cause anorexia, increased metabolism, and negative nitrogen balance. Systemic effects result in poor food intake, increased nutrient and energy needs, and catabolism of body tissues. An individualized plan is based on the following: increased caloric needs ranging from 25 to 35 calories per kilogram per day, depending on metabolism, activity level, disease rate, disease state, and ability to absorb nutrients. Protein needs are increased to 1 to 2.5 grams per kilogram per day. Vitamin and mineral supplementation is based upon the client's needs. HIV and AIDS. The body's response to the inflammatory and immune processes associated with HIV increases nutrient requirements. Malnutrition is common and is one cause of the death in clients who have AIDS. HIV infection, secondary infection, malignancies, and medication therapies can cause manifestations and adverse effects that impair intake and alter metabolism. Decreased nutrient intake occurs due to physical manifestations, such as anorexia, nausea, vomiting, and diarrhea. Psychological manifestations can include depression and dementia. Nutritional findings include rapid weight loss, gastrointestinal problems, inadequate intake, increased nutrient needs, food aversions, fad diets, and supplements. Poor nutritional status leads to wasting and fever, further increasing susceptibility to secondary infections. HIV-associated wasting is characterized by unintended weight loss of 10% and at least one concurrent problem, diarrhea, chronic weakness, or fever, for at least 30 days. Diarrhea and malabsorption are prominent concerns in clients who have AIDS. Lipodystrophy can cause insulin resistance, altered glucose tolerance, and hyperlipidemia. Therapeutic nutrition. Creating an individualized plan for the client who has HIV and AIDS is based on reducing unintentional weight loss and wasting. Increased caloric needs ranges from 37 to 55 calories per kilogram. A high-protein diet is recommended with amounts varying from 1.2 to 2.0 grams per kilogram per day. Intake of a multivitamin that meets 100% of the recommended daily servings is sufficient unless a specific deficiency is identified. Enteral feedings are used if the client is unable to consume sufficient nutrients, calories, and fluid. Liberal fluid intake is extremely important to prevent dehydration. Client education. Consume small, frequent meals that are composed of high-protein, high-calorie, nutrient-dense foods. Complications. Early satiety and anorexia. Client education. Eat small amounts of high-protein foods loaded with calories and nutrients. Try to consume food in the morning when appetite is best. Avoid food odors. Do not fill up on low-calorie foods, such as liquids, broth, high roughage foods containing water. Eat cool or room temperature foods. Mouth ulcers or stomatitis. Client education. Use a soft toothbrush to clean teeth after eating and at bedtime. Avoid mouthwashes that contain alcohol. Omit acidic, spicy, dry, or coarse foods. Include cold or room temperature foods in the diet. Cut food into small bites. Try using straws. Replace meals with high-calorie protein drinks. Use well-fitting dentures. Prepare food that are cooked until tender and soft. Add gravies, broth, and variety of mild sauces to moisten prepared foods. Fatigue. Client education. Eat a large, calorie-dense breakfast when energy level is the highest. Conserve energy by eating foods that are easy to prepare. Use a meal delivery service. Food aversions. Client education. Eat foods that are well tolerated and liked prior to treatments, chemotherapy, radiation. Taste alterations and thick saliva. Client education. Try adding foods that are tart, citrus juices, eat small, frequent meals. Try using sauces and seasonings for added flavor. Use plastic utensils for eating. Suck on mints, candy, or chew gum to remove bad taste in mouth. Sweeten meat with apple or cranberry sauce. Nausea and vomiting. Client education. Eat cold or room temperature foods. Try high carbohydrate, low fat foods. Avoid fried foods. Do not eat prior to chemotherapy or radiation. Take prescribed antiemetic medication. Sit up for 1 hour after a meal. Sip on fluids throughout the day. Try ginger ale or ginger tea. Diarrhea. Client education. Ensure adequate intake of liquids throughout the day to replace losses. Avoid foods that can exacerbate diarrhea, foods high in roughage. Consume foods that high in pectin to increase the bulk of the stool and to lengthen transition time in the colon. Limit caffeine, hot or cold drinks, and fatty foods. Okay, a nurse is instructing a client who has cancer about the ways to increase protein and calories. What actions should the nurse include? When taking actions, the nurse should instruct the client to substitute whole milk for water in recipes, add milk, cheese, yogurt, or ice cream to dishes, use peanut butter as a spread for fruit or crackers, use yogurt as a topping for fruit, and dip meats in eggs, milk, and breadcrumbs. A nurse is planning a community presentation on nutritional guidelines for cancer prevention. Which of the following instructions should the nurse include? Increase intake of food high in vitamin A, consume crucifers vegetables, and consume whole grains. A nurse is collecting data from a client who has HIV. Which of the following findings are manifestations of HIV-associated muscle wasting? Fever for 30 days. A nurse is teaching a client who is undergoing cancer treatment about interventions to manage stomatitis. Which of the following statements by the client indicates understanding of the teaching? I will avoid toasting my bread.